doctors that made home visits. Now doctors, if you're trying to get a home visit, you might spend $1,000 a month for some kind of concierge service. But I had a relative who was in Rio de Janeiro recently, and they went through, I'm going to call them the barrios, but it's not a barrio, it has another name. But they had these healthcare people who were trusted in their community. And they were like giving blood pressure, immunizations, vaccinations, checking people's heart, even with machine guns and like gangs all around, because they were trusted people. So, you know, if I had a magic wand, because it's hard to find a doctor, I mean a physician. It's hard to find any kind of doctor, really. It's really hard to find a physician, depending even on the insurance you have. And so we had something like people that we could, not just a clinic, but people that just walk around, like come to your home, and you know if you're over 65 or 75 or 80, or if you're disabled, they're going to come and not just check on you, but check on you in terms of they've got a healthcare background. I think that would really be, when we talk about health disparities, something good to have in our community.
Have you engaged with community health workers? That's exactly I think what you're describing. Those people
the closest thing that we have, and we had that program, is the community outreach workers. And they were trained to go out in the community and talk to families and provide services. But not direct services, indirect services.
But are they still, is that still going?
Well, no, that's an interesting question.
After the pandemic, the roles got limited.
Right.
And so,
and the contract,
like everybody else, is trying to figure out how to get back on track and what's safe for them to do. Every time the COVID rate appears to go low, it jumps up again. And so they have to be concerned or careful about how they manage that.
Right, and currently the contract for the African Americans is held up under the Riverside San Bernardino Native Americans.
The Native Americans have the contract
for the African Americans. But
I know the city of Rialto, they have the Healthy Rialto, and they partnered with Kaiser. They did have a health teacher come out and do a lot of things. I did actually advocate for and recruit some seniors to attend the classes. But you know, you mentioned something also about, you know, connectivity and to relate. They came with ideas for health and food, but some of the food ideas that they brought, we had like menus and stuff, it wasn't food that some of the residents are accustomed to. So we also has community gardens. I happen to have a plot. Then Summers also has a plot. And so they didn't have any food, like for example, cactus, nopales, or, you know, I don't even think they mentioned vergoladas, which is very popular. How do you say vergoladas in English? I don't know.
per se.
Per se, yeah. But, yeah, so a lot of the food that that community that was involved, so there was a disconnect. Like, the expert came to share with us, but it wasn't some of the food that we ate. So that was, it was helpful.
So there's a little bit of a disconnect,
yeah, there
right?
was a little bit of a disconnect. So the person that is coming to facilitate, and even though they're a health person and they know these things, it's not, if they don't have that information about the food, you know, you kind of look at your garden and say, you know, do I need to change up? So like even the aloe vera and things like that. The other thing that was mentioned was how this younger generation may live to be over 100, and that's wonderful. I'm happy for them. However, you know, I brought my father to come live with me, which is the best thing I ever did, because he came to live with me. I started getting those grab bars, getting things for him, but it started triggering what I was teaching at that time. And it got me thinking, what about when I get older, which I think he was like 80, I was 40 or something like that. But it just really got me thinking. And I thought, how many young people miss that? Again, when someone mentioned, hey, we need to start preparing the young people for, we don't think that, because when you're 20 and 30, you think 40 is old, you know? Yeah, so, you know, you don't envision 60 and 70, and I'll tell you that my father's physical health at 80 is better than my health right now. And I know, even though we might have access, the food that we're eating now, you know, unless you're in charge of your own personal garden, like my garden, I know that only dirt, natural fertilizer, and water goes in there. But anything else, you know, and a doctor told me when I told him, oh God, I'm so scared to get cancer. He said, you know what? He said, you already have cancer.
Yeah.
He goes, what people don't understand, during my father's lifetime, they would get cancer because of something, something that happened. You know, you ate something, you know, we were working in the fields in Bakersfield picking potatoes and grapes, and the pesticides was all on us. Okay, that's how we got cancer. But my dad didn't, because they ate better. You know, they ate better. He's from Mississippi, and everything they ate was healthy. Now the food that we're eating, yeah, I'm gonna hopefully live longer than him, but I'm not as healthy as he was. So when we think, oh, these young ones are gonna live, but what condition are they gonna be in?
Right.
See, that is what scares me.
That's a really good point.
You know, to me, that is.
Because you didn't have hot Cheetos.
Oh, no. And I still
Hot
don't.
Cheetos is the big killer.
And I still don't eat them. And I think, but I think it's important to, you know, even have that mindset. And then someone else mentioned about stages. You know, young people don't learn stages. You know, again, you see a lot of people with cell phones and they're texting, but you know, they can do this. But a lot of young people cannot type because typing and woodshop went out of the high school, and so they don't know how to, you know, they can just do this real fast, but they can't do what I can do. And I actually remember that it was such a big deal. I remember being excited when we went from a carbon paper. You had to stick a carbon paper and then press really hard. Oh my God, when we had that ditto machine, oh, that was like so modern. And don't get me started about NCR form. Oh Lord. And so, but if you explain that to a young person, you know, the stages, they're like, okay. I'm trying to explain to my children, my young children. They're like, okay, I got it. But they don't got it. And so it's like if they don't pay their dues, they don't even get the information. They're losing. They're really losing something. So, you know, I just think it's huge. And now that's why it's so easy for some of us to go into the data entry and things like that. I just wanted to say also last, I'm very concerned about this AI, blah, 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 because I advocate for seniors, and I saw what happened during COVID, even myself personally. I saw so many seniors get into a very dark place, a sadness that people cannot understand. And here, a year and almost going on 2 years now, where things have, you know, kind of roller coaster normalized, but you know, there's a little something going on again. I see some of the seniors still not able to bounce back, to, you know, to get it together, to, you know, with the technology. And I think honestly, computers are great, can't live with them, can't live without them. Kind of like a band, right? So, just being funny on this. But I have to tell you, I went to the doctor for my ankle. I gave him the notes. I wrote notes. And then, thank God for, I'm in my 70s, so thank God I opened up the app to see what he wrote. I have a boot on my left, and he said that the problem was with my right. Now, how many seniors go to the app and open up and say, look at the doctor's notes? So you see, even all this technology, but you still better look at those notes. But they put in, because his notes were wrong. Yeah, but the guy's a walking encyclopedia, he's a genius. But guess what? He inputted something wrong, and when you go to get your prescription and things like that, with all this technology, people say, don't worry about it, we'll send it in the mail, don't worry about it, it's out there in the iCloud or whatever. You might be, getting information that could put your life at danger.
That's right, that's right.
Exactly.
If I could ask a question, Dr. Sarita, so how do you feel, and what's the relationship between SCAN and PACE centers?
PACE centers. So I don't know if everybody know what PACE is.
No.
Yeah, so it's a program for all-inclusive care for the elderly. It's a program that actually has you have to be eligible for it. So it has certain criteria. Typically, older adults who frail older adults. I think it's a way to also prevent people from having to go to nursing homes. So you have a doctor, you have a full care team. There's transportation to and from the facility. It's a very comprehensive model that actually has proven that it's very effective when it's done right. And that's nice. The challenge is it has very limited. There's limited slots. It's growing, but there's not that much availability, and the criteria for getting in is limited. So not everybody is eligible, right?
You have to sell your home.
You do not have to sell your home. It's actually funded, and it's actually federally funded, and then it goes down. So to answer your question about plans and PACE, there are a lot of health plans now that are exploring creating PACE as a part of their offering. Meaning they would get funding from the federal government, but they would also coordinate it with their own systems. If that makes sense.
Yeah, it does make sense.
Yeah, so that's what we're seeing more and more. And then the other thing to be aware of is there's a lot of private companies, private equity, all these people who are also investing in PACE. And that's causing it's in one way good because it can add a lot of, they can make things bigger and scale, they can grow them, but at the same time we're also seeing some challenges with the quality of care. So but yeah, I don't know if that answers your question, but there's more. I think we're seeing more of PACE and medical care, like even I think Kaiser Permanente is looking at PACE models. They're really hard to set up, by the way. There's a lot of regulations before you set up a PACE thing. That's probably why a lot of people, it's not going as fast as maybe it should, because it takes a long time.
So we're waiting for one to come right here on the west side,
Okay.
and Mrs. Brown and I went to Long Beach to look at one.
Yeah.
Like she said, a really comprehensive center,
Yep.
has everything that our seniors would be able to find beneficial, like can go and get their hair done, can take a shower, so it will serve those that are also unsheltered. You see the doctor, the dentist, physical therapy, go in for a 4-hour stint and be able to have lunch, take a nap. They have sleeping rooms. You could have all type of activities. And so we have seen that it's taken them a long time to get up and together before they can even ground break. But it would be right behind community hospitals so that there's access if emergency access is needed. But it is to provide and to make sure that folks don't have to go into nursing homes. So we can provide that care and to give some respites, like I can go take a rest for a little while and still be able to connect with friends, have lunch. And so I thought that the whole concept, and Mrs. Brown has been educating me on this concept as well, that it's very beneficial to have one in the community. So I'm sure that, and I have heard that there are a lot of independent, private companies that are trying to establish them.
Yeah.
So we would just have to keep our eye to make sure that the quality of care is what it needs to be.
I think if that is the case, whoever funds these PACE centers, that the community has to be and I think that's a requirement of PACE, like you have to get a community buy-in to be able, and the community needs to be essentially overseeing it, making sure that they're not cutting corners, and not, quality of care. I think there's been some instances where we're seeing some problems, so I agree. But I like the model. The only thing is that, again, they're actually talking about expanding the criteria, right? But that's going to require more funding. So
It used to be that the PACE centers were you could only be a nonprofit.
that's right. It's like
And then the
2017.
rule changed.
Yeah, 2016 or
And
something.
it started saying, okay, you can make a profit, you can be a profit-making company, and you can get a PACE center. Well, everybody's jumped in, and that's why I checked with people up and down the state to find out that the company that was coming in here would be good for us. So we're gonna have to stay on top of them and make sure that they are gonna be a good partner in our community. So you let them know.
If I may.
You know, go ahead, Carl.
We talked earlier about the transitional care. Just after I got out of the hospital, the South Medical Center sent a nurse to my home once a week to check up on me, take all my blood, take all my vitals, inspect the home, and inspect me to make sure I was okay, to reduce the amount of time that I had to go to the emergency room. And they even found they found one medicine that was regularly interacting with another medicine, and if they wouldn't have caught it, I would have killed it. So there are programs, the cell uses it, and also IEHP.
Yes.
And the other thing, a lot of people are not aware that our population is declining, and our population is going to continue to decline. Are you talking about that declining population in healthcare management yet? Or what are we going to do with less young people to serve more old people?
That's a conversation, and it's not even just happening in the United States, it's happening
Worldwide.
globally. I mean, like, look at Japan, like the oldest country in the world, and they don't even have it in China and everybody's scrambling right now. So they're trying to find a lot of community supports to answer that question. I think it's a really important question, Carl. I mean, like, how are we going to have, this gets back to caregiving and supports. Like, do we even have enough to support older, and we don't right now. We don't have enough. Yeah. So thank you. I mean, that's
We have, Ms. Betty?
I think he actually did part of what I wanted to say, because having just come through some health challenges, when I get out, I find I've got like 4 nurses calling me. One coming by once a week. I just canceled her appointment with me because I'm here. But it's somebody calling from a management company. And essentially what we have is a phone conversation. So then I have my family that's in healthcare going, well, if you're taking your own blood pressure and calling it in, then why do we need her? And at one point, when I was still, because of all this going on, I had like 4 folks calling me. So the stuff is for coordination. How do we get this stuff coordinated so that I don't have to be my own case manager?
university database.
Yeah, somehow it has to work so that the person in care is not feeling oppressed by all the health workers. And a lot of it is grant driven. Will you take a survey after this conversation? All for input, and because that's where I come from. I will grant for the next grant that they're going to write. So you're not really sure what's going on about keeping you out of the hospital. And they're very honest. We don't want you to go back to the hospital. What you going to do about calling them home?
So they did a good job in my case, and I see your ears.
Before we go any further, we're getting ready to kind of find out if anybody has any last burning things they'd like to say before I introduce Dr. Tate. But I wanted to also tell you about Alma Gomez. She is a city council member from the city of Victorville in the county of San Bernardino. That's her husband that came with her. That's Mr. Gomez. I didn't have his first day. I told her to write it down, but she anyway, I really appreciate you coming. We really appreciate you coming. But she drove from up on the top of the hill. Remember I talked about that earlier today? You have to come from Victorville down here, and you don't have transportation. How you going to get down here? She happened to have a nice car. But what about, we have some seniors up there, and that's what we found in our study, that they could not get down here. So that's how we got into that transportation thing, where we did all of the surveys and so on.
Are you seeing any improvements in the transportation right now? I mean, like in terms of how to better utilize those services? Like, Inland Empire uses a lot of dollars to pay for transportation.
Yeah, but it's not, what do you say? It's not what? It's not handy? It's not
We don't see it. It's not efficient.
It's not efficient. It's not adequate. It shouldn't take you 3 hours to get to Victorville
That's a 30-minute drive for her,
Right.
30 or 40 minutes.
Got it, got it.
So yeah, it's really, they gotta do more.
Yeah.
Now, what I think they're doing is trying to do more with the trains. But when the train leaves here, or is it gonna be when it leaves?
It's gonna take you to Montana, then it's gonna take you to LA, then it's gonna take you
Right,
to.
I'm not talking about that train, I'm talking about the train that's going from here to Vegas.
The real.
Oh, that's gonna be interesting.
Well, a lot of people are gonna be taking their money and going to Vegas.
Go Raiders. They got freeze for that.
You know, I haven't heard from a young person, and I purposely made this an intergenerational activity because I think it's very important for young people to be a part of this conversation. So before I turn it over to Dr. Tate, can I have a young person that wants to say what you've heard and what you're thinking about as you age? Oh, go ahead. Here's one. Okay. Oh, good. Okay. Go ahead, you first.
I'm Lakeisha. I work with the City of San Bernardino Parks and Recreation. I oversee the Senior Service Division. Our issues right now are, as y'all stated, transportation, lack of food, lack of housing, lack of support. Just, there's no safe space. There's no safe space, especially for seniors who were stuck in a home and then lost their homes after COVID. There's no safe space. There's nowhere they can go. There's nothing for them. So those are the issues we are dealing with, at least in our senior facilities. And a lot of our seniors, at least, I would say a good percentage, 15% are homeless. They live in the park right next to the center, or they live by the door.
Yeah.
And they just wait for us to open on Monday so they can get that one meal and wait till Tuesday for the 2 meals. And then by Friday, they're just waiting for Monday to come in.
Yes.
You're awesome. You are.
I know
She is.
Okay.
So, Dr. I heard you mention that you have seniors outside of the senior center and they are unhoused. And so you work for the city. I really encourage you to contact the Department of Aging and Health Services